Bored on call in the hospital. Healthcare workers of Reddit. What is your nastiest, strangest, most amazing work story? I'll start. As a green EMT with only about 6 weeks working experience, I climbed under a car at night in the pouring rain to try to take a pulse on a patient who had been struck and dragged about 100 plus feet. It was a super chaotic scene and I didn't have a flashlight, so I didn't realize the full extent of the patient's injuries until I was under the car with him. Basically, his legs were bent out sideways at his pelvis and flipped up so that his feet were near his head. He was very clearly dead. I had never seen such traumatic injuries and quickly scrambled out from under the car. I still remember that every time I squeeze under my car to change the oil. Also a doc here. We get the most interesting stuff. As you can see with all of these posts from the I've seen some interesting stuff. Had an AMA a while back. Anyway, the strangest case involved a woman coming in screaming her head off that there's a hand in my vagina. I asked the nurse what's up. She gave me a quick story that PT felt something in her vagina this morning, so came to the ED, LMP about 1 month ago. I was thinking to myself, she'll probably end up in psych for an evaluation after a pelvic. Anyway, I was busy taking care of another patient, so the nurse took the patient to a gyn room. She is still screaming her head off. The nurse roomed the patient and rushes to get me. I think you should see this doc. She did indeed have a little bluish hand arm sticking out of her vagina, up to the forearm. Of all the crap I've seen in the ED, this was probably the most bizarre and amazing. Still thinking this will not ever be matched. Ended up she had a miscarriage at some point, and the baby was on its way out. No fetal heart rate on ultrasound, so we called gyn. Gyn came down, dated her to be about 22 weeks. She still swears she had monthly periods, so she had no idea she was pregnant. I am not quite sure how I would react if a hand came out of my vagina. I worked on an ambulance in Seattle for 4 years. Got called to a house one night for a welfare check on a 60-something guy bedridden after knee surgery 8 months earlier. Place was a crack house with garbage everywhere. We went to the second floor and found the guy in a bedroom filled with cigarette butts, beer cans, and porno mags. Room stank horrible. Coffee cans filled with pee and crap everywhere. Lots of flies and baby flies. We rolled him over and found his white sheet was stained black like the whole thing had been drenched in tar. His backside from shoulders to butt was rotten and completely raw. Visible spine and pelvis. His wounds were filled with mounds of white maggots, which probably saved his life. We called fire departments to carry him out and took him to a TLDR. Guy bedridden and neglected for 8 months had raw open wounds filled with maggots. One time I had a female patient admitted for alcohol intoxication. Her blood alcohol level was 0.56. Since she was an alcoholic, her body tolerated the levels and she was still somewhat awake. We had to place a urinary catheter. Every time I went to place the catheter, she would start gyrating. I'd have to stop due to uncontrolled giggling, and then she'd yell, "Come back here. Don't stop." One of the most uncomfortable situations in my life. I can't even. I've had a urinary catheter put in while I was awake, and it was painful. Certainly not something to gyrate about. My mom is an oncology nurse. Irrelevant. And the weirdest thing to happen at her hospital was last year. Year before. Who knows? Anyway, on her way into work she saw that someone had left a morbid looking display of a person with no head near the entrance. She thought it was really inappropriate for a hospital, as did most of the other workers. Turns out it was a real person who had gone to the hospital entrance and blown his head off in the AM. People thought it was a Halloween display for over an hour until someone realized it wasn't a grotesquely realistic setup. I'm at work now and can't find the article, but it was in Fall River, MA, in front of Charlton Memorial. I work as an auxiliary nurse and a couple of years ago I was on a renal ward. Patients that require dialysis have a fistula in their arm made up of an artery and vein joined together, and sometimes these can burst, producing a proper arterial spray. So it's afternoon visiting time. Room's full of families and I hear a shout from a 4-bedded room. I run in and this old man tells me his fistula has burst. I don't register what is going on quite quick enough and ask him to show me what has happened. He then pulls his hand away from the inside of his elbow and unleashes a nice stream of blood that shoots out, hits me perfectly center mass, stains the whole of my uniform top completely. Before I can shout at him to cover it again, other nurses and doctors rush in to deal with the problem. Curtain is drawn round and I'm standing, covered in blood, sheepishly smiling at all the horrified visiting families and trying to sneakily wipe away the pool of blood that is slowly seeping out from under the curtain. Eventually he's taken away to have the fistula surgically repaired and we clean up the bed space. I need to go get a clean pair of scrubs obviously, so I go to take the elevator down to the surgical levels. By now it is the end of visiting time, so the lift is packed with families from different wards and I am very unsuccessfully trying to cover the massive blood stains all down my front. I think I scared quite a few people that day. TLDR. Got covered in blood, scared a lot of visiting relatives. My aunt was preparing to operate on an old Greek man with a long history of smoking and what was believed to be a large tumor. After opening him up, they discovered the tumor was a sponge. It had been left inside him after prior surgery in Greece. RN here. I remember in my first year working on a monitored area on a med-surg floor, a young male patient arrested and we started CPR. One of our orderlies got on the bed and started chest compressions and after a few seconds, a cardiac rhythm came back and the patient woke up, looked at the orderly pressing on his chest and said, "Get the F off me," and then passed out a few seconds after compressions were stopped. The monitor read asystole. Everyone around the bed was a little shocked but the doctor running the code then told the orderly to resume chest compressions. After maybe 5-10 seconds of chest compressions, the patient wakes up again and looks at the orderly, tries to push him off with his arms and say, "I told you to get the F off me." The orderly slid off the bed and the patient passed out again after a few seconds and flipped back into asystole. The doctor yelled at the orderly to resume compressions and to not stop unless he says so. So basically, 2 nurses had to hold down the legs and feet of a patient that was awake while an orderly did chest compressions on and off. Pretty strange. In nursing school during my ICU rotation, I got to assist in a dressing change for a patient who had necrotizing fasciitis in the abdomen and had spread downwards. And by assist, I mean watching in horror as the nurses went fist deep into this morbidly obese patient's wound trying to get a grip on her flesh. Apparently the patient was diabetic and was giving herself insulin shots without swabbing with alcohol and what I assume being unhygienic overall. If I remember correctly, the nurses were trying to change the wound vacuum dressing. It can be tricky to do, as the sponge needs to be shaped correctly and the clear dressing on top needs to be sealed nice and tight so the fluids can be sucked out. Well, the wound was huge and it went down both groin areas to the inner upper thigh. Add the big stomach flap and it became almost impossible to do with only 2 nurses. That's when me and a buddy were called in. Luckily, I have a strong stomach but it was a shock to see. I'm sure I have other stories, but I just finished a 12-hour night shift, so it's sleepy time for me now. For those who don't know, necrotizing fasciitis is also known as the flesh-eating disease. I wasn't working in the hospital, but I was camped out at the admin station in a once compiling admission stats for the previous year. They brought in a huge Samoan guy, probably 350 plus lbs. He'd hurt his back somehow and was in a lot of pain. Wheeling him on a gurney, there's only about 10 feet and a curtain wall separating me from him, so I can clearly hear him say, "How am I gonna take my crap?" and the nurse says, "I'll bring you a bedpan." Now I've never used a bedpan, but crapping lying flat on your back is probably a chore. Combine that with a painful back injury, then round it out with 350 pounds of Samoan grade A beef, and you know it's not going to end well. A couple minutes later there's a grunt, a kind of clank, and an overflowing bedpan comes shooting out from under the curtain, skipping across the floor, leaving a trail of crap splatter behind it. There wasn't a solid piece of crap in the pan. It was like it was filled with chunky pudding. The smell was overwhelming. Nurses were gagging. Freaking nurses couldn't take the smell. That's how bad it was. Even after they mopped it up, the whole place stank. Eventually a nurse started handing out spray cans of mosquito repellent, the closest thing to air freshener they could find. Eventually a nurse started handing out spray cans of mosquito repellent, the closest thing to air freshener they could find. Best thing I've read all day. I was working in a hospital blood bank a few years back. I had finished a routine type and screen on a lady who was in for a routine pelvic mass removal, and the doctor didn't order any units on her. Straightforward, right? I get a call about a half an hour later from the surgeon directly, which is strange. Usually a nurse will call us, asking if I'd cross-match a few units for him, just in case on this patient. I sent 3 units of PRBCs up to the OR, then another 15 minutes later I get another frantic call from the surgeon saying, yeah, I think I'm going to need a couple more units. I have never moved that frantically around the blood bank in my life. About midway through the surgery, and already 75 units deep, a perfectly healthy kidney comes down to histology. We're all freaking out in the lab, thinking someone screwed up and removed a kidney from the wrong patient. Turns out the surgeon accidentally severed the renal artery on our routine mass removal patient, and the only way for him to stem the bleeding was to remove the kidney. This poor woman ended up going through almost 200 units in about 2 hours time, between PRBCs, platelets, plasma, and cryo. The more sad part is that because this woman's circulation was so poor during and after this routine surgery, one arm and one leg became necrotic and had to be removed. The patient was only in her 50s. She was lucky to be alive. Turns out the surgeon accidentally, and that's when I knew crap just got real. I would never want to hear the word accidentally in reference to a surgery performed on me. Many years ago when I worked as a nurse's aide in a nursing home, a nurse called me in to assist her in catheterizing a patient. She lifted his gown, lifted his small penis and picked up the catheter. Before I could blink, his penis had sucked away from her fingers and literally vanished into the man's abdomen. I mean, it was gone. Nothing left but a dimple. She excused herself and didn't return. When I went to look for her, I found her standing in the med room laughing so hard she was crying. TDIL. Some men have retractable penises. I've been to nude beaches and I can attest to the fact that some guys indeed do seem to have in us. EMT here. Plenty of stories, but this one's my favorite. I was doing my normal overnight shift when I got a call for an MHA by local law. For those who don't know, an MHA or mental hygiene arrest is when law dictates that someone must go to the hospital for a psychiatric evaluation due to threatening or actually hurting oneself or others. This guy had been drinking all night and had threatened to kill himself. Law had found him hitting himself in the head with a clip of 1-inch steel brads, basically nail gun ammo. Needless to say, he was going for a little ride. Oh, and he only spoke Spanish. So I show up and they walk this guy out to my ambulance. They tell me exactly what I just told you and hand me the guy's cell phone and the brads. I take them and hop into my rig and off to the hospital we go. So now I am doing my normal psych transfer and everything is well and good. I thought, seeing as how it is a 30-minute ride to the hospital we were going to, I decided to do an assessment of the guy. For paperwork's sake, I use my own app on my phone to ask the questions. Simple yes, no types. Everything is nominal until I ask him if he has any pain. He says yes, and points to his head. Confused by how precise he's saying his pain is, I take a closer look. I find a small drop of blood by his temple, and my thought process went as follows. That's fresh blood. That's fresh blood, but he has been sitting next to me for 20 minutes. That's a small hole. With fresh blood, you know, that hole's pretty small. It looks like one of those nails he had. That's kinda funny, but the only way you could have that is if you. That's fresh blood. That's a small hole. The only way you could get that is if you shot yourself in the head with a nail gun. That's fresh blood. Oh my god, he shot himself in the head with a nail gun. He actually shot himself with a nail gun. At this point I have several things going through my head. So I half pantomime, half scream, "Did you shoot yourself with a nail gun?" To which he replies, "See, test time." So I just call up to my driver to step it, because now my priority 4 basic psych transport just got escalated to a priority 1P penetrating head trauma. The entire time the guy is completely conscious, alert, and oriented. Stayed that way while they pulled them out too, from what I hear. Oh god, I started laughing in horror at, see, test time. Oh my god. I work in stores and distribution at our local hospital, working in IQ, ordering inventory, the code blue, cardiac arrest, an alarm starts going off. I help clear out the hallways expecting trauma team to run through. Instead, about 6 nurses start wheeling out an older woman from the room. The doctor was on top of her, her chest was split open from the sternum, and the doc was massaging her heart. The rest of the team was charging into the OR. Still to this day I don't know if she made it. That was pretty intense. Second case. Bum on an electric scooter rolls into her. Says his back hurts. He changes and lies on a stretcher waiting for the doc. He stinks. As in fricking reeks. Easily the worst stench I've ever encountered. Imagine month-old sweat urine mixed with rotting flesh. So the doc and a couple nurses check him out. They roll him over and his back and buttocks are covered in maggots, eating away at bed sores that he got from never moving. Doc thinks about leaving them to clean wounds, ends up removing them himself. Nurses take the stroller outside and throw on hospital grade cleaner. The maggots squirmed out of the miniature like spiders out of an egg. Gross as heck. Like spiders out of an egg. Dude. I once arranged home care for a woman who had used caulking to make her own anal dildo. Needless to say she couldn't get it out and needed a resection to remove the caulking from her intestines. Nothing like a huge scar to remind you of your own stupidity. My wife was a resident at a county hospital in a large city in the Midwest. She had a lot of foreign body stories. My two favorite ones. 1. 30-ish guy came in with his mom. He had a raw potato up his butt. His mom actually said, "I don't understand. He doesn't even like potatoes." 2. Middle-aged guy comes in with a bat, the flying kind, that had died in his rectum. His story was that he had been taking out the trash when it just flew right up there. He then had waited 3 days, hoping it would fly back out. One of the other residents suggested sending in lemon after it. That guy was batshit crazy. I'm not a doctor, but my roommate's sister and brother-in-law have some great stories from rural Australia. During one day in the local hospital, a man came in saying he had lodged some beads, or some sort of similar artifact in his brown cabin. So, routinely, they decided to get some x-rays to check on its progress the wrong way up his digestive system. They took the patient, let's call him Boss Man, through, got him scanned but found nothing. When confronted, but man said that this had happened before and that the reason it wasn't showing up was because it was some sort of plastic silicone hybrid that was difficult to see on the x-ray. So, the next step was to grab some gloves and manually search for it. The butt man dropped his dax and they were underway. After a couple of minutes of not finding anything, the doctor looked at the patient and realized he was sweating and smiling. Turns out there was nothing there. He was just a frisky bastard that wanted a doctor sticking their fingers up his anus. TLDR. Buttman wants cavity search. You would think there are cheaper ways to get cavity searched without getting a doctor's bill. I'm a social worker who does psychiatric intake in an Last week, I had to assess a patient with paranoid schizophrenia. The remote controls to the televisions in the have a cord, similar to a phone, so patients don't walk off with them. When I walked into his room, he was talking into the remote, like it was a phone. He goes, "I got someone in here who wants to talk to me. I gotta call you back into the remote." Then he hangs it up and goes, "Sorry about that. Business call." At least he was polite enough to end his call for you. My mom worked behind the secretary's desk in a large hospital. She usually just had to direct appointments to the waiting room, but there were always emergency patients to take care of. One night, a woman walked up to the desk with nothing but a backpack. She had wrapped her arms around herself and just stood at the desk, with an ear-to-ear grin and wobbly legs. My mom looked up and said, "Can I help you?" After a long pause, the lady mumbled, "I talk too much," and waltzed on into the waiting room. After 10 minutes, a man walked out of the waiting room and said, "UHH, there's a lady on the floor in there," and walked back in. My mom hurries in and sure enough, Mrs. Backpack is on the ground with an open bottle of Advil next to her. As my mom walked up to her, she groaned, "I took too much." TLDR. Never mumble when you OD. When I was a resident, I was working the one night. This was during the O.J. Simpson trial. They brought a woman in by ambulance that had been stabbed by her boyfriend. I was assigned to work the airway, so I was at the top of the bed above her head. She was laying there wide awake looking at me with a huge kitchen knife, the kind you would cut a head of lettuce with, sticking out of her throat. It had lodged itself in the bone but didn't hit any major vessels. I held her head and told her, "Don't move." She looked up at me, smiled, and said, "Looks like I got OJ, doc." She was taken for surgery and ultimately did fine. I have problems laughing at inappropriate times and I wouldn't have made it though that one okay. Pink slipped. I had a 38-week pregnant patient come to L&D last year with the following story. She claimed her boyfriend was putting together the crib and left stuff all over the bed. She was tired and laid down to go to sleep when she felt something go into her vagina. I examined her and pulled out a Phillips head screwdriver. Fortunately, she didn't hurt the baby. I don't know how many times a screwdriver has accidentally waltzed into my vagina. Used to work in endoscopy clinic. Received a medical report that just said, found false teeth, removed false teeth, returned false teeth. Not the most amazing story, but made me giggle a fair bit. I hope endoscopy doesn't mean what I think it means. 56-year female comes into the ER during the night shift. Complains of abdominal pain and pain during urination. I give her a cup for a urine sample, comes back with barely 5 cc's. UA comes back normal. MD goes into gyn room to do a pelvic exam on PT. MD comes back out and asks me to page urologist. Foreign object in PT's urethra. PT stated that the Sharpie cap came off and got lodged in her pee hole. When MD asked why she did it, PT states for sexual pleasure. Hi, a doctor, attending physician, supervising doc. Over the loudspeaker they call for an attending to bed 1/bed 2. They're next to each other in one large resuscitation room. And I have a sick patient in one, so naturally I think they must have taken a turn for the worse. I rush in and ask what's wrong with that patient. And the nursing staff say that yes, he's doing much worse and appears to be herniating. Brain swelling to the point that it exits the skull base and squashes important regulatory parts of the central nervous system. But no, the reason for the overhead call was the new patient in 2. The new patient in 2 is in severe respiratory distress, and the resident is preparing to intubate. I ask the nurse for the patient in 1 to start hyperventilating, infuse mannitol, and page neurosurgery, and then I start coaching the resident for the intubation. Immediately afterwards, in the seconds during which we're standing around, smug, I notice what looks like a wet patch on the respiratory therapist's jacket, and then another, and then another, and I look up and notice that there's now a nice trickle of water coming down from the ceiling, and then a torrential downpour of warm water. It's at that point that the patient in 2 goes into ventricular tachycardia, and the tech, now an old friend, is standing over her chest with cardioversion paddles, a stricken look on his face, asking, do I shock her while we're all standing in an inch of water? At this point both patients are soaked. There's water everywhere. Let's check for a pulse, I say, which, fortunately she had. Lidocaine. This was years ago, and then we wheel both patients out for drier grounds. Later, I learned that you can safely cardiovert patients in standing water. The EMTs here probably already know this fact. Also, our emergency department is below the hospital cafeteria. A dishwasher broke and spilled its contents on us. TL. DR. 2 coding patients. Dishwasher pours water on us while we consider electrocardioverting one of them. NB. It's difficult to write these stories without getting crazy jargony. Doc, I tell you what. Paramedic for 17 years. Busy EMS fire service. I wouldn't have cardioverted standing in that much water either. Undergrad student here, but I have done plenty of physician observations. My nastiest experience was during a shift. 80-something man comes in from nursing home. Man had previously fallen, after repeatedly calling nurses to no avail, trying to go to the bathroom, and was in a halo brace. This was 5 weeks into his halo brace, and the nurse that was cleaning him at the home noticed he had a bed sore on his back that extended to under the halo. Due to procedure they had to bring him to her for evaluation. I was actually able to help the doc with unscrewing this guy's halo from his head to be able to remove the chest piece so we could get a look at the back. When we pull the brace off, the attending mutters under his breath, "Whoa. 40 years of emergency medicine and I have never seen one this bad." What followed was 1.5 L of gravy looking pus, which smelled the entire for the rest of the 6-hour shift. He cut open part of it and would slowly roll over the other half to keep squeezing out more pus. This guy's bed sore was gigantic, and the doc notified the ethics board and whatever other governing body about neglect on the part of the home. The sight and smell could only be beaten by the comment when we were leaving by the doc, "He will likely not live through the infection he will get from this." Those nursing home idiots just handed him his death certificate. Bed sores that led to patient death are disappointingly common, especially in nursing homes. Keeping costs down means low staff numbers, poorly trained nurses, etc. Seen many a person lose massive portions of skin, whole limbs, or die. Grandpa found on Christmas morning dead after giving himself a heart attack jacking off at night. Discovered pants down, dong out, with Vaseline still open next to him. He came as he went. My friend works in a hospital and was helping an old lady walk to the bathroom. The old lady was about 90 and as my friend was walking behind her she proceeded to sneeze and the lady projectile shitted all over my friend. There was even a crap outline of her body on the wall. TLDR, crap on the wall. The crap outline made me cry tears. Manly tears of laughter. I've posted this before, but it still takes the place as the strangest thing I've ever dealt with. I was shadowing a neurologist at a free clinic and saw a few patients. The last patient of the day was an older man, probably mid-50s. He started talking to the doctor about some pain in his lower back, headaches, other common stuff. I was starting to wonder why he had scheduled an appointment with a neurologist for this sort of thing. Then his girlfriend called and asked what the doctor had to say about his memory problems. The poor guy had forgotten that he was supposed to talk to the doctor about the fact that he had trouble remembering a lot of things. Luckily the neurologist thought it was just a case of low oxygen flow to the brain, which is easily corrected with breathing devices, but it was still a very strange experience. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.